Katie O'Donovan. I'm a senior and I'm in the physician assistant program at Butler. EBM stands for evidence-based medicine, and so basically that means you take all the best research that you can find, clinical trials, tests, and you apply it to the way that you practice healthcare so that the patient has the best possible treatment. EBM is the basis for all the guidelines that various organizations would recommend or make. It's how you know which drugs have which side effects, and it's how you know which treatments work more effectively for different populations. So it's pretty much the basis of all clinical decision making currently. So EBM apps take the information that just EBM research finds and brings it into a format that a clinician or a healthcare worker can keep with them and look up quickly and kind of also use with their patients in a more interactive way so that the patient can have more of an understanding of why the treatment recommendations are what they are or how they can best help their own health and treatments. The way that these apps are kind of changing practice is that you can make them interactive. So, for example, there's like a cardiac screening app to see your cardiovascular risk and if you need to be put on medications for that. So you can sit down with the patient, show them the app, and have them go through and answer the questions with you, and then it will show the recommendation for them based on their specific characteristics. And so it really brings less of the paternalistic style of medicine where a doctor is just telling a patient, this is what I know and this is what you're going to do, and it creates more of a conversation and gives patients a little autonomy over their own health care and some more understanding in those decisions. I think one of the best things about EBM apps is that they provide confidence to healthcare workers kind of right away. So if before the apps and before technology was widely used in clinical settings, if a doctor or a PA or a nurse or someone didn't know how to answer a patient's question, they would leave the room, they would go look through a bunch of textbooks. You know, it would be a longer process. But if a patient asks a question, you now have the same level of reliability with resources right at your fingertips that you can kind of answer right away and keep that communication more fluid with your patients.